Uh, Thank you, sir, Panir Selvan, sir, and for introducing me and for inviting me for this talk. And Vishal, sir, for his kind words on substance-induced psychotic disorder. So what I would do is, so the topic is substance-induced psychotic disorder, and I will be focusing predominantly on cannabis and alcohol. I think because we will be seeing predominantly cannabis and alcohol, I think we need to know more about these things. Okay, so I have presentation in 3 parts. So one, I will talk overview of substance-induced psychotic disorder. Second, I will talk cannabis and psychosis. And third, I will be talking about alcohol-induced psychotic disorder. So the part 1 starts here, the substance-induced psychotic disorder. So basically, I will cover some history and which substances are known to cause substance-induced psychotic disorder. What are the mechanisms of substance-induced psychotic disorder? Who are at risk, and what are the predictors of progression for substance-induced psychotic disorder, and what is the progression rate for each substance. What I will not talk is ICD and DSM criteria because most residents will be aware of it, and I have included in my slides in the end after my presentation so that people can go back and read. And I will not also not talk on the treatment part because we can have a discussion on the treatment part. So these are a few lines from a book in 17th century, which is written by Thomas Arnold on causes of insanity. So what he tries to tell in this, these are some of the lines from the book. Such active substances like wine, opium, and other narcotics possess a like property of affecting, when habitually indulged into excess, a progressive change in renal system favorable to insanity. It appears, therefore, that intoxication may emulate almost every species of madness, where the temporary state arises from intoxication to remain after the immediate operation of liquor had ceased. It would no longer be intoxication but insanity. So basically, he's talking about alcoholic hallucinosis, and sometimes it actually happens. So this is the book. So then Kraepelin, after a century later, he has reported cases of alcoholic paranoia and hallucinosis. He was also one of the first persons to report about cocaine-induced delusional insanity, and later often demonstrating bizarre schizophrenia-like delusions and passivity experiences, where it started with substance-induced psychotic disorder going on to schizophrenia. Although most patients recover from cocaine-induced delusional insanity, delusions could persist long after the cessation of use. That means a person, even though develops a substance-induced psychotic disorder, can progress to schizophrenia. Then in 19th century, around 1958, Cornell was the first person to describe amphetamine-induced psychosis in his classical monograph. So here comes the question, which substances are known to cause psychosis? Most commonly methamphetamine, cocaine, cannabis, synthetic cannabinoids and cathinones. Although these are entering into Indian market, still we don't see them very rampantly. So we had our first presentation in 2015 in EMANS about synthetic cannabinoids and cathinones. Although we are sporadically seeing these cases, we are yet to see full-blown spectrum of synthetic cannabinoids and cathinones. Then hallucinogens are also implicated in development of substance-induced psychotic disorder. Alcohol, one important thing is alcohol per se do not cause psychotic symptoms under intoxication, but withdrawal of alcohol causes psychotic symptoms, which is classically described as alcoholic hallucinosis or alcohol-induced psychotic disorder. So the second question is, what is the mechanism of substance-induced psychotic disorder? Although neurobiological studies suggest that different receptors are implicated in each substance, but coming to specific substances, for example, stimulants and cathinones, these fall into a similar group. Cathinones, synthetic cathinones, have similar action like stimulants. So they produce psychosis through dopamine receptors. Cannabis and synthetic cannabinoids, they produce psychosis through cannabinoid receptors, CB1 receptor. And hallucinogens, if someone is preparing for PDF entrance, this is one important MCQ, that hallucinogens act through 5-HT2A receptors to produce psychotic symptoms. There are few drugs which are not basically seen in India, but seen elsewhere. For example, in Southeast Asian countries like Thailand, Indonesia, Salvia divinorum and Mitragna species. So these act on kappa receptors. And ketamine, which is again sporadically seen in Indian context, but has been a drug of abuse elsewhere. It produces psychosis predominantly through NMDA antagonist action. So who are at risk of substance-induced psychotic disorder and its progression? People who have family history. This we have been studying from ages, that people who have family history of drug use disorder, alcohol use disorder, and non-affective psychosis. These are the people who are at risk of developing substance-induced psychotic disorder. And cumulative risk for progression to schizophrenia is around 11.3%. Matlab, if you take all the drugs together, and if you consider substance-induced psychotic disorder as one entity, then the progression is around 11.3. Individual drugs we will come later, but you need to understand that the study here I am quoting is a national registry. So you can tell about progression of substance-induced psychotic disorder to an independent psychotic disorder through different study designs. For example, this is a national registry. There are also 3 or 4 cohorts which have been followed up for a period of 30 years or 40 years. They also contribute to the evidence how the progression of substance-induced psychotic disorder to an independent psychotic disorder happens. So that we will be coming in our later slides. So what predicts the progression of substance-induced psychotic disorder to an independent psychotic disorder? Based on this recent Swedish sample study, I am sure that everyone will be knowing Kendler, and this has been study that has been published from the Kendler's group in 2019. So this has a huge sample size. One important predictor of progression is if a person has substance-induced psychotic disorder in an early onset, if there is a family history of psychosis, not substance use disorder, male sex, and people who have recurrent episodes are at risk of developing independent psychotic disorder when there is a substance-induced psychotic disorder. So what are the transition rates? So there is a recent systematic review and meta-analysis. If a person has been diagnosed with ATPD, I am sure all of you would have seen ATPD. I'm also sure all of you would have seen substance-induced psychotic disorder, both the cases. In case of ATPD, the progression is around 35%, but when it comes to substance-induced psychotic disorder, it is around 25%. This has been a recent systematic review and meta-analysis, head-to-head comparison between what is the progression of ATPD to schizophrenia versus substance-induced psychotic disorder to schizophrenia. So which substances have higher risk of transition to independent psychotic disorder? One of the substances, cannabis, followed by hallucinogen, followed by amphetamine, followed by opioids, followed by alcohol. Although you should take this with a pinch of salt that opioids does not cause a psychotic episode, but in people who are dependent on opioid, they are also at risk of developing an independent psychotic disorder. So although I wanted to take a quiz after this, because of I will take at the end, we will have. So the second part, so I have given a brief overview of substance-induced psychotic disorder. Now comes the real thing about cannabis and psychosis. So as you all know, history of cannabis before 20th century, somewhere in 1772, Gross has described about problems associated with bhang in India. And 150 years later, in around 1840s or around 1900, Morio has described the association between cannabis use and psychotic symptoms. One important document that has been published by Britishers based on some research that has happened in India is the Indian Hemp Commission report in 1893, which actually did not find an association between, for example, low consumption of cannabis and development of psychosis. And coming to 20th century, THC, which is the primary component which is associated with psychotic symptoms, has been discovered. And later CBD, which is, so many people come and tell us, sir, what is THC, what is CBD, what is the difference? So THC is the, come and ask us, what is CHD and THC and what is CBD? So THC is the major cause of psychomimetic property. CBD has a protective role, which modulates the psychotic property, which is also anxiolytic and antipsychotic. And CBD is something that has been used in many studies for its medicinal uses. And the role of endocannabinoid system has been not only in terms of schizophrenia, but also in terms of neural development, has been described in the later part of the 20th century. Again, in 21st century, there is something that has come up is synthetic cannabis, which has more potency, at least 10 times more potency at CB1 receptor. As the potency increases, there is also an increased risk of psychosis. And there has been a lot of changes in terms of policy, which again brings cannabis and psychosis to our attention, especially to the psychiatrist's attention, is because of decriminalization, legalization of medical use, and later legalization of the recreational use that has happened across different parts of the world, which resulted in increase of potency of cannabis. If you see the potency of cannabis in 1990s, the THC component concentration, it was around 4%. Now in 2019, based on an aggregated increase, seems to be around 15%. And further, as the THC level increases, the concentration, the ratio between CBD and THC, which was earlier 1:14 in 1995, it has increased significantly to 1:80. That is, the CBD concentration has come down significantly. Again, you all know that cannabis contains more than 500 distinct chemical compounds, including 120 phytocannabinoids. So for this part, what is my objective? These are some of the questions that I'll be answering. Can cannabis cause psychotic symptoms? What does evidence suggest? Cannabis cause psychotic symptoms. Can cannabis cause psychotic symptoms beyond a period of intoxication, which we call it as cannabis-induced psychotic disorder? Can cannabis alone cause schizophrenia? Can cannabis increase the risk of schizophrenia? Is cannabis use part of schizophrenia, or is it separate? So be cautious. There is a difference, which is specifically you need to understand that there is a difference between causation versus association. Association doesn't mean causation. If you have to tell causation for something which is associated, it has to fulfill Austin Bradford Hill criteria. If you go back and remember what you have read in SPM, so it tells around 9 criteria, the strength of association. So there are different criteria. I will be sharing in the slides. The last slide is about this criteria. So association doesn't mean causation. Okay, if you see the temporal relationship between cannabis and psychosis, so there are 3 conditions. One is intoxication psychosis. So the onset of psychosis immediately following the exposure, but the psychotic symptoms are brief. So this is intoxication psychosis. As soon as the blood level of cannabis comes down, the psychotic symptoms comes down. Second is onset of psychosis is immediately following the exposure, but lasting longer than the intoxication. That means that the blood level of cannabis has come down to an extent, the intoxication has come down, but still the psychotic symptoms persist. This is exactly the cannabis-induced psychotic disorder. Then the last one, later onset, persistent and recurrent psychosis. That is, this persists, the psychotic symptoms persist beyond a period of 1 month. Then you call it as schizophrenia. So the first question is, can cannabis cause psychotic symptoms? Yes, the answer is yes. Single intoxication of cannabis can cause both positive and negative symptoms. This we call it as intoxication psychosis. And I would like to bring to your attention the article that has been published by the group which works in Yale, Deepak D'Souza, and Suhas Ganesh, who was my senior, is also part of this study. So I would recommend PGs to go back and read about this article. So if you have to make some inferences from this slide, the left side is positive symptoms. Yes, cannabis causes positive symptoms. Also, the right side is negative symptoms. Cannabis intoxication causes negative symptoms also. But one more inference that you can see is that these symptoms are transient, and as soon as the time progresses, both these symptoms comes down. The third important inference is the positive symptoms are more pronounced than the negative symptoms. So if you see, cannabis-induced psychotic disorder is predominantly polymorphic picture where you have both positive symptoms, negative symptoms, anxiety symptoms, mood symptoms, all these symptoms are there. So predominantly the cannabis-induced psychotic disorder, the term that we use for cannabis-induced psychotic disorder is the polymorphic picture. The continuing to this same question, can cannabis cause psychotic symptoms? The evidence is very strong. Who develops psychosis, the intoxication psychosis when a person uses cannabis? It depends upon the potency, the route of administration, and the dose. Early cannabis use and genetic vulnerability predicts people to develop intoxication psychosis. Does CBD has moderating effect? Matlab, if the CBD content is slightly on a higher side, does it prevent from developing intoxication psychosis? Yes. Naturalistic studies have shown that CBD has antipsychotic property, but lab-based studies and systematic reviews of these lab-based studies shows that this moderating effect may not be present. Again, this was one of the recent article by Dr. Suhas, who is currently working in CIP. And this has been published from the Yale University, which has shown that the CBD THC concentration of 1:1 has been found to actually moderate the antipsychotic property of CBD. Coming to the next question, can cannabis cause psychotic symptom beyond the period of intoxication? Yes, and the evidence is moderate. So if you see the ICD and DSM criteria, 4 things are needed. One is temporal correlation, prolonged beyond the period of intoxication or withdrawal, and the period described has been 1 month, and it reduces with abstinence. Although there has been conflicting scientific, the scientific world conflicts this, thinking that many don't believe that this kind of entity exists. But this understanding this entity is very important because cannabis-induced psychotic disorder, the chances of recurrences is high, and CIPD may be a harbinger of schizophrenia. Matlab, if you have seen 35% of the people who develop cannabis-induced psychotic disorder progresses to schizophrenia. Can cannabis cause psychotic? Same question. So the time to develop psychosis, based on the research, it has been found that if a person starts cannabis and the development of first episode of psychosis is somewhere around 6.3 years. Again, this is also dependent on age of use and dose at which the person started using. Again, the same group, Kendler group, has found that although the 35% of conversion of cannabis-induced psychotic disorder schizophrenia has been from a meta-analysis, this is from a cohort study where they have found that 18% of the diagnosed cases of CIPD progresses to schizophrenia. There is also research that comes from India, where they have, from NIMANS, where they have followed this CIPD cases for a period of 10 years. And they have found that 7.7% of the cases diagnosed with CIPD gets converted. And the conversion time is 39 months. So the previous 6.3 years is to develop. The 39 months is once it develops, the conversion time. And most importantly, people with family history of psychosis have higher risk, also predicts the progression, and the duration of stay in the hospital during the first episode, age of cannabis-induced psychotic disorder are predictors of progression. If you see, this is one of the latest study which has been published. This is a multicentric European study where they have followed up different populations starting from 2010 to 2015, where they have found that as the concentration of THC increases and the CBD concentration decreases, predominantly the daily, there are 2 indicators in this study. One is the daily consumption, the regularity at which the person consumes, and the potency. As the daily consumption increases and the potency increases, there is a higher risk of developing psychosis. Again, if you see, This is again based on the epidemiological studies where they have found that as the potency increases, there has been threefold increase in development of psychotic symptoms. And it has been shown that at least 50% of the psychosis that develops in London and 30% of the psychosis that develops in Amsterdam can be prevented if there is no high potency of cannabis available in the market. Then the next question is, can cannabis alone cause schizophrenia? The answer is no. It is called as component cause of schizophrenia. What is meant by component cause of schizophrenia? It is neither necessary nor sufficient to cause schizophrenia. So cannabis needs some other component to develop schizophrenia. So what are the different components? If you see in this, so there is a genetic risk. Again, there are genetic risks and cannabis use is there. Then a person can develop schizophrenia. There is a genetic risk and there is also a childhood sexual abuse, that is trauma is there. Then a person can develop schizophrenia. Then cannabis use is there, genetic risk is there, and urban upbringing has also been identified as a risk factor. Then a person can develop schizophrenia. So basically the concept is that it is defined as component cause of schizophrenia, but it cannot cause schizophrenia. It is neither sufficient nor necessary to cause schizophrenia. Again, so there are few cohorts which has been following the cannabis use for a longer period of time. Matlab, people who are using cannabis and who develop psychotic disorder. One important cohort that you need to understand is the Swedish conscript study. So where from 1970 onwards, they have been following up this cohort, and where they have found that single use of cannabis increases the risk of schizophrenia by 2.4%, whereas 50 times use of cannabis increases the risk of schizophrenia by 6 times. Again, they have followed it in 1987, then they have followed it in 2002, and they have also followed it in 2012. So by the end of 2012, they have identified that cannabis use increases the risk of schizophrenia by 3 times and twofold psychosis, the psychosis that you don't characterize as schizophrenia. Again, there is a cohort called as Dunedian cohort study, which is from New Zealand. They have followed the same cohort has followed again from 1970s to till date. So earlier cannabis use, people who use cannabis before 15 years are higher risk of schizophrenia compared to people who use later, that is after 18 years. So these are different cohort studies. One important take home from all these cohort studies is cannabis use brings forward the onset of schizophrenia by at least 2.7 years. For example, if a person is destined to develop schizophrenia at age of 26, if he uses cannabis, the chance of he developing schizophrenia by 24 is something that has been defined in these studies. So it brings forward the onset of schizophrenia by at least 2.57 years. Is cannabis use part of schizophrenia? Could be. So what does that mean? So there is something called as shared vulnerable hypothesis, which means that people who are at risk of developing schizophrenia are people who use cannabis. So therefore, cannabis use comes first rather than cannabis use leading to schizophrenia. It is because they are vulnerable to develop schizophrenia and they are also vulnerable to develop substance use disorder. That's why they are using schizophrenia. So that is one hypothesis. The other thing is patients diagnosed with schizophrenia consume cannabis more than alcohol, and people who use people who are at risk of developing schizophrenia, you know that self-medication hypothesis of cannabis, self-medication hypothesis why people with schizophrenia use cannabis is because of boredom, socialization, to get stimulation, to feel good. And people when they develop schizophrenia also use cannabis to improve their negative and depressive symptoms of schizophrenia. Again, there has been a lot of debate whether this cannabis use is part of schizophrenia or cannabis use is right from schizophrenia. Does people with cannabis use does people use cannabis as a part of schizophrenia? Is it a self-medication hypothesis? It is debated for last 20-30 years, and it is too early to discard this finding. So if I have to give a conceptual framework for this stress vulnerability hypothesis, so there is a genetic vulnerability of COMT or AKT polymorphism, which, just give me a second. So there is a genetic vulnerability, and on the top of this genetic vulnerability, if there is environmental factors like child sexual abuse or trauma, and there is an increased stress level, which these two lead to increased stress level, which leads to use of cannabis, alcohol, or other drugs, and can precipitate schizophrenia. So this is one stress vulnerability hypothesis that has been given by Hamilton. This is also one of the interesting articles by Hamilton et al. So who are vulnerable? Again, just briefly on genetic studies for the purpose of PGs. These are some of the things that has been described in the literature: the COMT polymorphism, AKT1 polymorphism. And one important thing is we are not able to pin down onto a single gene. It is more of polygenic vulnerability, and people with family history of psychosis are vulnerable. One important thing is there has been no sex differences, although the earlier some studies report that there has been sex differences, but this study by Maria that there are no sexual differences in this sex. Again, there has been some research in terms of does cannabis use lead to epigenetic changes. Too early to comment, but there is the preclinical and human studies demonstrate epigenetic effects of exposure to cannabis, predominantly DNA methylation. This is one important interesting thing. I am not very sure whether you heard about this. This is something called as bipolar schizophrenia network for intermediate phenotypes. So they basically identified 3 biotypes, and one of the hypotheses is that cannabis subtype of schizophrenia has been described, which comes under the biotype 3, where all the 2 biotypes have abnormal biomarker signature, whereas this biotype has a relatively normal biomarker signature, where they looked into the epigenetic changes, the hormonal changes, the EEG changes, and here they also identified that this biotype is associated with high frequency of exposure to cannabis in adolescents, low frequency of family history of psychosis, more intact cognition and brain structure. It is possible that there may be a sporadic subtype of psychosis with predominantly environmental determinants like cannabis use. While genetics are more important in the previous subtypes, here that much importance for genetics has not been given, and further studies are needed to validate the proposed subtyping of this psychosis. Again, endocannabinoid system has been extensively studied in schizophrenia. Whether endocannabinoid system is implicated in conversion of substance-induced psychosis to schizophrenia, again, we still don't have evidence, but there is some evidence that there has been increase in CSF anandamide levels in people who are at risk of developing schizophrenia. Coming to the third part, which is alcohol-induced psychotic disorder. Does alcohol cause psychosis? Not related to intoxication, but it can cause alcoholic hallucinosis. The other important disorder that alcohol causes is alcohol-induced delusional disorder, the persistent delusional disorder that happens because of alcohol use, specifically delusion of infidelity. The most important thing is that alcohol, although it does not cause a psychosis, but it worsens the course of people suffering from major mental illness like schizophrenia or bipolar disorder, and it also causes poor compliance to medicines. So this is one article I think Nurul also has highlighted, the phenomenology and course of alcoholic hallucinosis. This we have studied for almost 6 years of data, looking into what is the phenomenology and course of alcoholic hallucinosis. Briefly about this study, people who develop alcohol-induced psychotic disorder. Alcohol-induced psychotic disorder is, that is F10.52, alcoholic hallucinosis. When people stop alcohol, they start having hallucinations, delusions. And this is brief lasting, generally doesn't last beyond a period of 1 week. Based on ICD-10, it doesn't last beyond a period of 1 month. Again, alcohol-induced psychotic disorder is different from delirium tremens. So that differentiation is important because there is no delirium in alcohol-induced psychotic disorder, whereas delirium tremens has delirium picture where there is altered sensorium, impaired consciousness, other features of delirium tremens. So 2/3 of the patients with alcoholic hallucinosis had a past history of alcohol-induced psychotic disorder or alcoholic hallucinosis. Again, we have emphasized on the concept that people who are at risk are people who have family history of psychosis rather than family history of substance use disorder. The other important point here is that auditory hallucination is more than visual hallucination, and majority presents with only hallucination. Delusions are usually secondary to auditory hallucination. Other important finding is people who suffer from this alcoholic hallucinosis have some amount of insight that is preserved. So the suicidality risk is higher. Around 20% of our study population has suicidal risk. What is the conversion of alcohol-induced psychotic disorder to an independent psychotic disorder? It is around 13%. One more important point here is that benzodiazepine is the treatment of choice. Antipsychotics can be given as add-on only in case of uncontrolled or severely symptomatic cases. So other substance-induced psychotic disorder like cocaine-induced psychotic disorder, amphetamine-induced psychotic disorder, synthetic drugs, hallucinogens. I think if there are any questions, we can have that for discussion. So if I have to summarize, there are many substances that increase the risk of psychosis. If you have to remember, one important predictor of psychosis onset and also psychosis conversion is a family history of psychosis. Cannabis specifically can lead to psychosis. One is intoxication psychosis. Two is induced psychosis, that is psychosis which lasts beyond the period of intoxication. Third is cannabis precipitating and worsening the course of schizophrenia. Can cannabis cause schizophrenia? It is called as component cause of schizophrenia, which means that it is neither sufficient nor necessary to cause schizophrenia, but there should be some other factors along with this to cause schizophrenia. The possibility is that cannabis use can be part of prodromal symptoms, the self-medication hypothesis that we have discussed, or the shared vulnerability hypothesis that we have discussed. Alcohol-induced psychotic disorder is associated with hallucinations predominantly, most commonly auditory hallucination. Suicidality is something that you need to keep in mind. And benzodiazepine, the study that we have done, diazepam and lorazepam are the mainstay of treatment. Only when there is a need, we might have to add antipsychotics. And usually the time frame in which the alcohol-induced psychotic disorder resolves is the mean time period was around 7 days. So it should resolve within 7 days. As per ICD-10, it is around 1 month. If it goes beyond, then you have to suspect an independent psychotic disorder. So this is my mail address. If you have any questions later also, you can write to me. This is the Hill criteria that I was telling. When do you call association as causation? So it should satisfy some of these things. That is the strength of association, consistency, specificity to other outcomes. Okay. So I have described for each and everything in detail. I will share the slides with Nurul. Nurul can share the slides with you. I think this is my presentation. Should we take the quiz now or should we take after the questions? Over to you, Nurul.
We will start the quiz, sir.
We will start the quiz. Okay. So let me share the screen. So you should announce what is the prize, Nurul.
Actually, we have given different prizes for different sessions, sir. Initial usage, we have actually had our book written by Dr. S. R. Chandra on cognition. Then for one session, we have given the pen, Parker pen. So this session, we are yet to decide, sir.
Okay. hopefully my internet helps. And okay. So what I would request the participants is, the quiz is online. So there are two ways you can participate in this quiz. The first thing is, open your mobiles and type slido.com and type #cannabis. Or you can open your what you call scanners, and you can scan the QR code.
Your audio is not very
can you
clear.
confirm?
Your audio is not clear, Dr. Narasimha.
Okay, so what I will do is, I will stop my video so that is my audio clear?
Yes, yes.
Yeah, now it's clear.
Now it's clear.
Okay, you are able to join the quiz?
Yes, sir. We have some people. I have joined.
Okay, chalo. So yes. Okay, to sensitize you, here is the first question. So just this is not the quiz. This is a dummy quiz. First, we will start with dummy quiz to see how many people have joined. And although there is no right or wrong answers. So we have 28 participants out of 135 online. So we have 32 participants, 35. Okay, 36, 37. Should we wait for one more minute, Nurul?
Yes, sir.
I think more participants will be able to join.
Yes, yes.
Okay. I think the movement has stopped. So we have 40.
Sir, actually, some people are asking the procedure again. So
okay, so there is a side on the side. It is there. You can scan the QR code, or you can open just slido.com and type cannabis. So you will be able to join.
Yes, after entering the slido.com, you have to type this code.
Code. So it will come as enter code.
Yes, yes.
As soon as you get the enter code, you have to enter as cannabis. Yeah. Don't worry, there are few more few more dummy questions before we go on to the main quiz.
Yes, till now around 40, so we can have another
40.
dummy questions. Sir.
Okay, so the question here is, if you could go for a coffee mug with a figure from the past or present time, what would it be? If you wanted a figure on this coffee mug from the past or present, what would you like to have? Let's see. Okay, Hitler. Wow, nice answer. Freud. Present. Okay, Freud. Nice. So Freud is the highest. Jeffrey Dahmer. Right. Nice. Shaktiman.
Someone typed Power Star.
Huh?
Someone typed as Power Star.
Power Star. Someone is from Andhra Pradesh here. In Karnataka also, I think there is a Power Star. Nice. Zeppelin, parents, Mango, God, but Freud is the leading person here. Okay, I think we have more than 35 active participants. 37, 38, 38, 41. The number of active persons are growing. Good to see. Okay, 42. Wow, nice. Okay, so Abdul Kalam, family, and Freud leads the race.
Yes.
Okay, so we will go on to the next question. What's the strangest thing you did while attending a meeting online? So you have been attending this meeting online. What did you do? What is the strangest thing? Not only this meeting, maybe in the past meeting also. Okay. Okay. Watch Netflix. Okay. Made breakfast. Okay. Okay. Others are prominent. Okay, now I think we have more active participation. Nurul, 52,
Yes,
55.
Yes, I will start the quiz.
Okay. So again,
Sir, so you can tell the disclaimer that people who are answering even wrong will not be known to anyone. So
yeah,
I
yeah.
think that's security made.
No, people,
answer.
people, what will be known is people who have what you call top will be known to everyone. People who did not top, matlab, only top 5 will be known to everyone. Okay.
Yes,
Again, to acclimatize yourself to the quiz, there are 3 dummy questions. So please answer those dummy questions. Then we will go on to the quiz. Okay, we have Dr. Harshita, Swati, Dr. Shivkumar. Chalo, we will go on to the quiz, dummy quiz. Okay, we have around 59, 60. Okay, we are going on to the dummy quiz. Okay. The question starts. So the questions has time. Who is the Prime Minister of India? Okay, I think 98% mark for Modi, yes. Which is the best dating app in India? So what do you think, Nurul? What is the answer for this?
Sir, Tinder, sir.
Which is the best dating app in India? Tinder. Okay. Okay, I think 66% answered. Let's see is correct. Yes. What is the character count for Twitter? You can Google and answer also. So let's see who wins this dummy quiz. Okay, so the answer is correct answer is 280. So I think Ankit Sharma, Pankaj Pawar, good. So these are the 3 people. So your rating is not only based on the correct answer, but also on the time. Okay. Chalo. Now let's go to the main quiz. So please join the quiz once again. I think 23 people have joined. 47, 58, 63, 65, 68, 69. Okay. I think 69 people have joined. Nurul, shall we start?
Yes, sir.
Chalo. Which of the following is the most psychoactive component in cannabis? Remember correct answer and also fastness at which you answer the question. Nurul, if it goes beyond 5 minutes, it's okay.
Yeah, no problem. No problem. You can continue.
Okay. Okay, most people have answered. It's correct. Then first reports about problem related to bang in India. Again, many of these questions are based on what we have discussed. Okay. Next, following statement is false. Okay, good. Many have answered correctly. Next question. Good. Okay. According to Bipolar Schizophrenia Network for Intermediate Phenotype Study, a person with schizophrenia and cannabis use falls under. So this was the study that we have been discussing about 3 biotypes, biotype 1, 2, 3, 4. Wow, nice. So at least 70% have been active during the presentation. Cannabis use among patients with schizophrenia increases the relapse rates, increases the hospitalization rate, pronounced positive psychotic symptoms, all the above. Nice. So till here, who is leading? Shamini, Indumati, Bhargava, Anonymous. Anonymous will not get prize. And Abhinandan. Chalo. Next, last few questions. False statement. Okay. What could be the possible cause of increase in cannabis-induced psychotic disorder in Denmark in the last decade? So basically, the potency has increased. That is one of the reasons for increase in threefold risk of cannabis-induced psychosis in Denmark. Which of the following contains highest potency of cannabis? Very easy question. So that everyone gets 1 mark and fastest gets the reward. Nice. So answer is hash oil. Again, a bigger question. In relation to genetic vulnerability for cannabis and psychosis, following is true. Nice. THC primarily acts through which receptor? Simple question. primarily or mainly acts to which receptor? Yes. Which of the following feature of cannabis intoxications? So this has more than one answer. Nice. So the answer is it causes tachycardia, not bradycardia. So again, this is something that has been new. DSM-5. The following are suggestive of cannabis withdrawal as per DSM-5. Again, more than one answer is there. There are more than one answer. Yes. So this is the result. Nurul.
Yes, sir, I am taking.
Mo, I don't know who is Mo. Can Mo unmute herself or himself? And Dr. Polami Laha. Nurul, have you taken the photo?
Yes, I have taken the screenshot. Can the participant Mo can type her name?
Can they just show their switch on their video for a photo with Nurul? And yeah, Monica.
Yes, congratulations, madam.
Thank you.
Other
Can you type your college
Yes,
name and your full name in the chat box, ma'am?
Can all the participants, winners, can they show their videos and so that?
Okay, sir. Okay.
Hello, Dr. Polamilaha. Where are you from? You are mute, Polamilaha.
I'm from Nimhan, sir.
Oh, nice. Good to hear. Monica is from Madurai Medical College. Who are the third winner?
Sir, I am Dr. Mauryadeep.
Where are you from, Dr. Mauryadeep?
Nimhan, sir.
Imams. Good. Who else is there? Okay.
And so the fourth one, sir.
Fourth one is
Sachin Sanjeev.
Sachin Sanjeev. Dr. Sachin Sanjeev, where are you from?
So from Trishur, sir, in Kerala.
Trishur from Kerala.
Okay.
Congratulations. And fifth participant.
Shamini. She's from
Shamini.
College.
I'm Shamini from Tirunelveli Medical College.
Oh, congratulations, Dr. Shamini.
Thank you, sir.
Okay. So over to you, Dr. Nurul.
Yes, sir. Sir, can I read out the questions in the chat box, sir?
Yes. I have not seen. Please.
So I'm just reading out the questions pertaining to our session, sir.
Yeah.
Yes, sir. If risk for an individual to get schizophrenia is 1% in general population, then what's the risk for getting schizophrenia among cannabis users?
If the risk for an individual to get schizophrenia is 1% in general population, what is the risk for
Getting schizophrenia for cannabis users?
Yeah, it will be again 15% or 20% more.
So then that 2 times, 2.4 times, 5 times, that is for acute psychosis, right, sir?
No. If you take people who are using cannabis, see, again, it has to be translated into in terms of percentage at the population level. So when you translate into population level, the statistics changes. It becomes around 1.5% at the population level. But at an individual level, it is around 2 to 3 times the risk of developing psychosis.
Okay, sir. Okay.
Yeah.
Sir, depot naltrexone or oral naltrexone useful for preventing relapses in cannabis use disorders?
We have published one article comparing. Again, it is published in Indian Journal of Psychiatry in 2018, where myself, Dr. Benegal and Dr. Lekang Shukla were the investigators. So we have looked into 2010 to 2016, what are the different treatment options. So again, it can be variable because of our prescription practices. NSTL16 has been found to be better compared to baclofen, compared to no drug alone. So in that, it was around, if I remember correctly, around 130 patients we have followed up for over a period of 5 years to see reduction in relapse rates. So the reduction in relapse rates were better when it comes to NSTL16 compared to baclofen, compared to no drug, just psychosocial interventions. So, but in that cohort, naltrexone was not there. And overall, in terms of review of literature also, naltrexone has not been found to be effective in terms of preventing relapses when it comes to cannabis. So as of now, till date, the evidence is for psychosocial interventions. Some evidence for NSTL16. Yeah.
Okay. Okay, sir. So in practical exam as a postgraduate, there are always had been and has been some kind of tricky questions. Example, management of maintenance treatment for bipolar disorder, then type of schizophrenia, and substance-induced psychotic disorder, substance-induced. So I'm presenting a case of recurrent psychosis, and he had a use of cannabis use along the course. So as a resident, so when examiner is asking such questions, so we may not be able to put across so many evidences from the research per se. So in the textbook point of view as a resident, so what are the rationale that I can give to delineate the existing case as an independent induced psychotic disorder? So what are the things that we can kind of say, sir?
So if there is no substance use in the picture, if that 1 month criteria cutoff has been taken, for example, after 1 month also, if the psychotic symptoms persist, then that is one indication that this person has an independent psychotic disorder. So DSM-5 talks about 1 month, and I think ICD-11 also talks about this 1 month criteria. Okay. Second thing is, for example, alcohol-induced psychotic disorder. If it is not alcoholic hallucinosis, giving a diagnosis of alcohol-induced psychotic disorder may not be apt, except that if there is a persistent delusional disorder, persistent delusion like delusion of infidelity, so then you can make a diagnosis of F10.51, which is alcohol-induced psychotic disorder delusional type. Otherwise, if these two are not there, giving a diagnosis that this is alcohol-induced psychotic disorder, if there is a psychotic episode, may not be a good idea. So that is when it comes to alcohol. When it comes to cannabis, always there will be a debate. One important thing is, if there is a recurrences, and if those recurrences also be associated with other mood symptoms. For example, one important thing, if you remember, we keep discussing that whether the mood symptoms started first or the mood cannabis use started first. Generally, what happens when there is a bipolarity, what happens is the person starts feeling happy for 2 or 3 days or a week. So there is an onset of mood episode, and following which there is the person starts using cannabis after the mood symptoms have started. Or when there is a onset of depressive symptoms started first, there are 3-4 days of depressive symptoms, following which the person starts using cannabis to relieve his depressive symptoms. So one, clinically, when you are talking about phenomenology, it is polymorphic picture for cannabis-induced psychotic disorder. Second is that 1 month criteria. Third is what started first, whether the mood symptoms started first, or the psychotic symptoms started first, or the cannabis use started first. These are some indicators. Again, And other thing is, if you have a access to urine drug testing, that also can be a supportive evidence.
Yes, sir.
But
Can
sure
you
shot, if you have
throw
to
some
tell,
lights on the urine toxicology? How can we implicate that toxicology in SIPD kind of discussions?
for example, you can if people have drug testing present or not present. Okay, so there are two kinds of drug testing. One is the card-based test and the quantification test. Okay, so when you are able to give a diagnosis, when, for example, the person comes with psychotic symptoms for last 2 days, and you are not sure whether the person has used cannabis or not. If the test comes negative, then